Good morning, everybody. Today we have a very interesting case of a very young patient. He has been operated 4 times with a microdiscectomy technique, which is a technique that leads to an opening of 10 to 12 centimeters on the back, and then removing the muscles to one side, and then accessing to the canal. We have to do laminectomy, we have to do flavectomy, we have to do several damages to the soft tissue. Well, he has been operated 4 times because he has got first discal herniations and then recurrency of these discal herniations. Well, he comes to our outpatient clinic with severe pain on the left leg, and he's got weakness, numbness, and the pain is increasing with the time. So we looked at after the case, we checked out the MRI, the CT scan, the X-rays, and we saw that he's got a recurrency. Means that the discal herniation that has been removed before has come back again on the L5-S1 level at this particular time. So he has been visiting another doctors where they suggested to perform arthrodesis, means fusion of the L4-L5 and L5-S1. Let's remember that this patient has been operated from L4-L5 level and L5-S1 twice, each one of them. So now the best option they offered for him is a fusion of these 2 segments. As the patient is very young and he's very active, and of course he refuses to do the fusion, we saw the case and we assessed the patient to perform a full endoscopic spine procedure, which is a minimally invasive procedure that is going to be solving his problem and probably not only taking out this discal herniation that has been recurrency, but also we will take out all the scar tissue. This case is very interesting because he's got so much scar tissue, he's got so much adhesions, so much fibrosis that it's making everything sticks and everything at the same color. So an open procedure, it might be dangerous or incurs in some risks for these neurostructures that are underneath all this fibrosis and all this scar tissue. With the endoscope, we can go with a minimally invasive technique and dissect slowly with the watering, because we keep using the saline during the surgery, which is watering the area and making this scar tissue a little bit softer. So we will be taking out all the fibrosis and the scar tissue slowly and dissecting the neurostructures till we see them completely clear. As our field is seen with a very huge screen and with very precise technique, we can dissect all these neurostructures and the transpassing nerve root till we reach a clear area and clean neurostructure tissue, and then we will just move it a little bit, move the neurostructure and the transversing nerve root to see the discal herniation that recurred, that came back or happened again, and take it out, go inside the disc, which is, as you see in the images, the patient doesn't have much more disc. So we go inside it and clean it a little bit and release all these neurostructures. In fact, as you see now, we dissected all the fibrosis, we dissected these neurostructures and we kept them clean. We take out this discal herniation, we seal the rest of the disc from inside, and we finished by seeing all the neurostructures liberated. Patient is going to be released within 2 or 3 hours. Sometimes the patient prefers to stay at the hospital because he feels comfortable. It's okay, but from our side as medical team, we can release him after 2-3 hours. He can walk, he can do normal life. We didn't damage neither the bone nor the ligaments, the important ligaments for the spine, and we didn't harm the neurostructures. So our patient is now perfectly recovered. The pain has gone. He's got some numbness on the cuff, but it's completely normal because he had chronic irritation on that nerve root, but it's not damaged. It works perfectly. He can stand, the strength is good and is proper. So the technique and the surgery was a successful procedure to solve this case. Now the pain he's got on the back is completely gone. Well, follow us for more cases like this one, and have a nice day.